Imagine breaking a bone. The first thing you think of is a clean, sterile hospital, the gentle hum of machines, and the promise of anesthesia. Now, erase that image. You are in ancient Rome. Your doctor's office is not a sterile room, but a small shop filled with the scent of strange herbs, drying animal parts, incense meant to cover the faint, metallic smell of blood, and the low groans of patients. On a wooden table, gleaming in the lamplight, is not a set of modern instruments, but a terrifying collection of bronze scalpels, hooks and bone saws. Your doctor, the medicus, is a figure of both immense hope and absolute terror. His knowledge could save your life, but his cure might be more agonizing than the injury itself. This is the world of Roman medicine, where science and superstition bled into one another. The secrets of what truly happened on their operating tables are more shocking than you can imagine. We see the glory of the legions and the genius of the aqueducts, but we rarely look into the dark and hidden world of those who fought to keep the Romans alive. What was the dark secret behind their surprisingly effective, yet brutal, surgical procedures? Subscribe now to uncover the strange and terrifying truths of ancient medicine. The common myth is that Roman medicine was nothing more than primitive butchery, a world of hacksaws and guesswork. The truth, however, is far more complex. Roman medicine was a startling paradox. On one hand, their understanding of disease was based on the flawed Greek theory of the four humors, which taught that illness was caused by an imbalance of blood, phlegm, yellow bile, and black bile. A fever, for example, was seen as an excess of hot and dry yellow bile, so the cure would involve cold and wet remedies, like cool baths or specific herbs. Cures often involved bleeding, purging, and bizarre herbal concoctions designed to restore this delicate balance. Yet, on the other hand, Roman surgeons were masters of practical, hands-on intervention. They developed surgical techniques for everything from cataract removal to brain surgery that were shockingly advanced, using tools that would not be significantly improved upon for over 1,000 years. This is the central mystery of the Roman medicus, a man whose mind was filled with flawed theory, but whose hands possessed a genius for healing. To understand the doctor, you must understand the medical world of Rome. There were no medical schools, no official licenses, no standardized training. Anyone could call themselves a doctor. The medical marketplace was a chaotic mix of practitioners. You had the pharmacopole or herb sellers, who dispensed folk remedies, and the iatroloped specialists in massage and ointments. At the top were the most respected physicians, often highly educated Greek slaves or freedmen, whose knowledge was passed down through apprenticeships. A wealthy Roman might even own a personal physician slave as a status symbol. The Roman state itself was largely indifferent to public health, with one major exception. The army, military hospitals, or valetudinaria, were highly organized, with dedicated wards, surgical suites, and sanitation systems, simply because a healthy soldier was a valuable asset. For the average citizen, however, healthcare was a gamble. You might visit a temple to pray for divine healing from the god Asclepius, buy a questionable potion from a street vendor, or, if you had the money, hire a medicus of good reputation. Your life was in their hands, and you had only their word to trust. The day of a Roman medicus was a study in contrasts. The morning was often spent making house calls to wealthy patrician families. Here, he was a diagnostician. He would observe the patient, take their pulse, inspect their tongue, examine their eyes, and perhaps even taste their urine or sweat for sweetness, all in an attempt to diagnose the imbalance of their humors. His prescriptions would be a complex list of herbs, dietary changes, and perhaps a recommendation for a therapeutic bath at one of Rome's great bathhouses. But the afternoon was when the dark secret of his profession was revealed. This was the time for surgery. Imagine a Roman legionary with a gangrenous leg. There was no anesthesia, only a strong dose of wine or a potion of henbane and opium to dull the senses. The patient would be held down by several strong assistants. The medicus would work fast, first using a tourniquet to restrict blood flow. His bronze bone saw, a marvel of Roman metalworking, would move with terrifying efficiency. The sounds of the surgery, the saw on bone, the patient's screams would echo through the building. After the amputation, the surgeon would use a red-hot iron to cauterize the wound, sealing the blood vessels in a cloud of smoke and burning flesh. But perhaps the most incredible procedure was cataract surgery. The medicus would take a fine, sharp needle, insert it into the side of the patient's eye, and carefully push the clouded lens out of the way, restoring some measure of sight. It was an act of incredible precision and nerve. with a 50% chance of success and a 50% chance of permanent blindness from infection. What do you think was more terrifying for a Roman patient, the disease itself, or the cure that awaited them on the operating table? Let us know in the comments. The most shocking evidence is still to come. Our knowledge of these incredible and terrifying procedures is not fiction. It comes directly from the historical record and stunning archaeological finds. Roman medical writers like Celsus left detailed encyclopedias of medicine, describing hundreds of surgical procedures with step-by-step clarity. From fixing hernias to performing tonsillectomies, the physician Galen, who served emperors, pioneered studies in anatomy by dissecting animals. His role as a physician to gladiators gave him a unique, gruesome window into the human body, allowing him to study wounds and internal injuries in a way no other doctor could. But the most visceral evidence comes from the ashes of Pompeii, particularly from a building now known as the surgeon's house, where an incredible cache of medical tools was found. These kits contain tools that are shockingly familiar to a modern surgeon: scalpels of various sizes, forceps for removing shrapnel, bone levers for setting fractures, uterine speculums, and surgical shears. They are a silent testament to the advanced, practical skill of the Roman medicus. The Roman attitude toward medicine was a reflection of their culture. They were a practical people who valued results over theory. While they might pray to the gods for health at the temples of Asclepius or St. They also expected their doctors to physically intervene. The practice of leaving votive offerings, small terracotta models of the afflicted body part at these temples, shows this blend of faith and physicality. Pain was seen as an unavoidable part of life, and enduring it with courage was a virtue. The medicus himself was viewed not as a high-status intellectual, but as a skilled craftsman, like a potter or a carpenter. His social standing was low, but his practical value was immense. This cultural mindset created an environment where doctors were encouraged to be bold and experimental, pushing the boundaries of what was possible, even without understanding the true causes of disease, like germs and bacteria. The greatest enemy of a Roman surgeon was not a lack of skill, but the inevitable infection that followed a procedure. In the end, the story of the Roman doctor is one of incredible courage in the face of the unknown. The bravery of the patients, who submitted to these agonizing procedures, is matched only by the bravery of the doctors who dared to perform them. They were pioneers, working without the benefit of germ theory, antibiotics, or anesthesia. Yet they laid the foundations of Western medicine through sheer observation and practical skill. Much of their advanced surgical knowledge was actually lost after the fall of Rome, not to be fully rediscovered for centuries. Their world was a brutal one, where a simple infection could be a death sentence, but their relentless struggle against that darkness, armed with both scalpels and superstitions, is a powerful testament to the timeless human quest to understand and heal the body. The ethical questions they faced when to operate, how to manage pain, and the ultimate quality of a patient's life are questions that still resonate in the heart of medicine today. What do you think? Was the Roman medicus a brilliant pioneer or a well-intentioned butcher? Let us know in the comments. If you're fascinated by the strange and terrifying truths of the ancient world, subscribe and hit the notification bell. And click here to watch our next video. The secret daily life of a Roman empress. More than just togas and power.